On the news tonight, at least 42 people killed by terrorists, with several individuals abducted in attacks on communities in Niger State. At least 25 people confirmed dead, while 14 others are missing following canoe accident in Nguru local government area of Yobe State. Tension in Osun State as local government workers are set to resume duties after 11 months. On the foreign scene, Venezuela's President Nicolas Maduro in custody at the New York detention center after he was captured during U.S. strike. Good evening, this is News at 7 on Western Spring Television. My name is Okwayemuni. At least 42 people have been killed by a terrorist, with an unspecified number of individuals, including children, abducted in attacks on communities in Agwarra and Borgu local government area of Niger State. President said the gunmen wreaked havoc on several communities before abducting scores, including pupils and students from St. Mary's Primary Catholic Primary and Secondary Private Catholic Primary and Secondary Schools in Papiri, Agwarra. Stephen Kabirat, the Director of Communications for the Catholic Church in Kontagora Diocese, confirmed the attacks on the Catholic Mission House. He said the terrorists killed over 40 people, abducted villagers, including children, and destroyed church property. Spokesperson of the Niger State Police Command, Wasiu Abiodun, assured that further updates will be provided as the situation develops. Troops of the Joint Task Force, supported by the air component of Operation Fansan Yama, have neutralized no fewer than 23 bandits fleeing Kano State, following coordinated attacks on Shanono and Sayawa local government areas. A statement on Sunday by the Assistant Director, Army Public Relations 3 Brigade, Nigerian Army, Major Zubairu Babatunde, said the bandits launched attacks on the night of Thursday, extending into the early hours of Friday. He said ground troops successfully contained the attacks and inflicted heavy casualties on their assailants before tracking the fleeing bandits to Maradua village in the Matazu local government area of neighboring Katsina State. According to him, intelligence reports revealed that the bandits had gathered at Dan Make in Matazu local government area to bury some of their members killed during the encounter with troops. He added that the operation, supported by area intelligence, surveillance, and reconnaissance missions, also led to the destruction of several weapons and equipment belonging to the bandits. In Kogi State, troops of the 12th Brigade of the Nigerian Army have killed 3 bandits and arrested a suspected logistics supplier during fighting patrols and ambush operation in parts of Kababunu and Yagba West local government areas of the state. The operations followed credible intelligence on the movement of bandits from the Adankolo general area towards Agbadu Bunu in Kababunu local government area. According to a Sunday statement released by the Acting Assistant Director, Army Public Relations 12th Brigade, Lieutenant Azan Abdullahi, troops swiftly deployed and laid an ambush at an identified crossing point. He said the bandits subsequently ran into the troops' ambush position and were engaged, forcing them to withdraw with indications of casualties as bloodstains were observed during exploitation of the area. The statement added that during the same operation, troops also arrested a suspected bandit logistics supplier identified as Sunday Adedotun from Odweri village in Yagba West local government area. Talking health, the Coordinating Minister of Health and Social Welfare, Professor Muhammad Fateh, says the federal government has administered over 25 million doses of measles vaccine and 22 million yellow fever vaccination nationwide. Fateh disclosed this on Sunday in a broadcast on his official X handle, highlighting significant gains recorded in immunization coverage and preventive health care delivery across the country. Beyond measles and yellow fever, Fateh said 5 million children had received the pentavalent vaccine, while over 10 million Nigerians were vaccinated with the tetanus diphtheria vaccine through the nationwide diphtheria response. He added that more than 1 million vaccine doses from the Gavi-funded global stockpile were deployed to support meningitis outbreak control in northern regions. The minister said Nigeria had also taken a historic step in malaria control with the introduction of its first ever malaria vaccine. He said that in 2025, the federal government committed $54 million in domestic resources to the global fight against tuberculosis and emerged as the largest African contributor to the global fund, as announced at the most recent G20 meeting in Johannesburg. He said since the launch of the HPV vaccination program in October 2023 across 15 states and the Federal Capital Territory, over 14 million eligible girls aged 9 to 14 years had been vaccinated, representing more than 90% coverage.
Tens of millions of measles vaccines, yellow fever vaccines have been administered in a massive nationwide campaign, as well as through our routine systems. Moreover, several millions of children have also been immunized with the pentavalent vaccine, preventing them from getting invasive bacterial diseases that can threaten their lives. Millions more have been vaccinated against tetanus and diphtheria since the inception of our nationwide diphtheria response. We're able to stop a major meningococcal outbreak dead in its track by administering the first pentavalent meningococcal vaccine from the global stockpile supported by Gavi Alliance. And that stopped a major meningitis outbreak in northeastern part of Nigeria. Nigeria also took important steps in combating malaria by adding to its armamentarium the malaria vaccine. As a country with a high malaria burden, accounting for significant malaria deaths in children younger than 5 years, the introduction of the R21 vaccine is another key milestone. For the majority of our people at risk of malaria, the vaccine only adds to our existing interventions such as insecticide-treated nets, seasonal malaria chemoprophylaxis, case management, and larvicidin. And the nationwide rollout has begun in Bayelsa and Kebbi states, where prevalence of malaria was high, and hundreds of thousands of children have already received some of those vaccines with the support of Gavi and co-financed by Nigerian government. There is still much room to scale up, and over time we will, but we also count on our people to bring up their children and be willing to get them protected against potentially deadly infectious diseases. Unlike in the past, Nigeria is now emerging to be a continental leader in the mobilizing of its own domestic resources to the health sector, and with its active commitments to the global effort against other diseases that afflict not only our people but also our neighbors, such as HIV, TB, and malaria. For example, just this year, the federal government pledged to contribute $54 million of its own resources to the global fight to stop tuberculosis by spending the money locally on Nigerian people. And we stood tall to make our contribution to the Global Fund against HIV, AIDS, TB, and malaria recently on the side of the G20 meeting in Johannesburg, South Africa, when President Bola Ahmed Tinubu approved a significant pledge by Nigeria contributing to the global fight, or with the resources to be spent domestically here in Nigeria.
Access to sexual and reproductive health and rights, SRHR information and services among adolescents in Nigeria has long been limited by stigma, limited youth-friendly facilities, and lack of privacy. Oralekon Akindoju reports that in Niger State, a quiet but powerful movement is redefining what empowerment means for adolescent girls.
Value Reorientation for Community Enhancement, VAS, is a non-governmental organization in Niger State with a focus on digital literacy for adolescent girls. However, through the VAS Girls Learning Hub, an initiative designed to support out-of-school girls, the organization is not only bridging the education gap, it is also transforming how young girls understand and access sexual and reproductive health and rights, information, and services. At the core of VAS model is the comprehensive sexuality education, a dedicated curriculum which allows girls to freely discuss issues affecting their bodies, relationships, and well-being, thereby building a level of communication and trust with facilitators and trained peer educators. According to Oluwatoyin Adebayo, Monitoring and Evaluation Manager at VAS, the curriculum covers topics like menstrual hygiene, puberty, consent, contraception, gender-based violence, sexually transmitted infections, and body autonomy.
And for some of them, they do not know those things. They engage in sexual activity not knowing what exactly it is, what are the things that are at stake, and all of those things. They do not know what their rights are. They do not know what the access is. They do not know all of those things. And so after the baseline survey, we kind of now use our results to inform our comprehensive sexuality curriculum. And then we've seen a level of impact in them in such a way that they are now able to make informed decisions about their body.
Approximately 23.7% of Osun State's population is adolescent, based on projections from a 2025 study that estimated the state's population at about 4.3 million. However, many girls, especially those in rural communities, rely on their mates or social media for sexual health information, often leading to misinformation and risky behavior. Before joining the UP, most of the girls had never been taught about reproductive health, as cultural and religious norms often prevent parents from discussing such topics with their children, leaving young girls uninformed and vulnerable. For 17-year-old Ifeoluwa, who dropped out of school at age 14, the UP became a turning point.
At home, you feel awkward, like, I'm menstruating. I cannot tell them that my menstruation is this or that, or I'm having this kind of pain that is extra my what I'm seeing that my sister are doing, or maybe the person I'm living with is doing that is different. But yeah, they make us understand that you can walk up to any of them, that there's nothing bad in it, since apart from since we are ladies, you have to have that boldness in you. Recognizing that knowledge must be supported by access, VAS helps to provide referrals and linkages to youth-friendly SRHR services. Ms. Adebayo says through partnerships with health professionals, girls are given access to confidential counseling, menstrual health products, and data-backed information. And currently, we work both in the formal schools as well as our own girls here at the hub. For the formal schools, we partner with some government schools across Osogbo on a project we call the VAS Health Club. And what do we do there? We actually have this talk with the girls. We talk to them about their menstrual hygiene, what they need to do, and then we provide them with, we supply them sanitary products, menstrual hygiene products. We teach them how to go about it, the essence, and then the importance of the fact, the importance of them making sure that they have proper care when it comes to their menstrual hygiene. Through its first and second cohorts, the VAS Girls Learning Hub has provided SRHR education and services to about 200 adolescent girls who were previously excluded from such opportunities. Beyond these individual gains, the hub is fostering a generation of girls who are better informed, self-aware, and capable of making responsible choices, a crucial step in reducing teenage pregnancies, unsafe abortions, and gender-based violence in the long run. Mrs. Roslyn Akinlabi, the adolescent health desk officer in Osun State, is impressed with the intervention. You cannot end violence if you do not empower girls. One major way to end violence, gender-based violence, is to ensure that they are being empowered. They are being empowered in terms of giving them quality education so that they can be enlightened, so that they can have certificates to look for jobs, so that they can have their own job. If they are empowered in terms of skills, you can be sure that you're in a short while, you are reducing gender-based violence. While progress has been significant, challenges remain. Some parents still struggle with the openness of SRHR discussions. Adolescent girls have limited access to targeted information and intervention, and there is still a lack of corresponding effort from the community. However, in a country where adolescent pregnancy and gender inequality remain persistent challenges, the VAS Girls Learning Hub offers a practical roadmap for positive change. Olalekan Akindoju, Western Spring Television News.
In other news, at least 25 people have been confirmed dead, while 14 others are missing following a canoe accident in the Nguru local government area of Yobe State. In a statement issued on Sunday, the Yobe State Emergency Management Agency said the incident occurred at about 7 p.m. on Saturday. The agency said a canoe carrying 52 passengers, mostly farmers and traders, capsized midway while traveling from Adiyani town in Nguru local government area of Niger State to Gabi town in Nguru local government area of Yobe. According to the agency, 13 passengers were rescued alive, while 14 others are missing, adding that search and rescue operations involving security agencies, emergency responders, and local community volunteers are ongoing. The Niger Police Force has ordered one of its officers caught on a viral video allegedly extorting a motorcyclist to report to force headquarters for disciplinary proceedings. The force also called for the officer's divisional police officer to report for possible sanction. The incident, captured in a video widely circulating on Sunday, shows a uniformed officer reportedly in Cross River State stopping a motorcyclist on the roadside and demanding cash. The footage depicts the officer counting the money while the motorcyclist appears reluctant. In a Sunday statement posted on X by the Police Complaint Response Unit, the force confirmed the authenticity of the video and announced immediate action. The Ogun State Police Command had earlier launched an investigation into a viral video showing a truck driver in Ijebode claiming he was pursued and assaulted by men impersonating members of the police force. The driver alleged that the attackers, who identified themselves as members of a task force, chased him around 4 a.m., damaging his vehicle and threatening his life. Responding, the Ogun State Police Command, through its public relations officer, Oluseyi Babasheyi, clarified in a statement released on Sunday that the men involved are not officers of the Nigerian police force. In Adamawa State, 2 weeks after a peace dinner hosted by Governor Amadu Fintiri at the Yola Government House, hostilities have resumed between the Bachaman and Chobo communities in Lamude local government area, with 3 Chobo women reportedly killed on their farms on Saturday. The Adamawa Police Command spokesman Sulaiman Nguroje, who confirmed the incident in a statement on Sunday, said the victims were allegedly attacked by suspected Bachaman militias around Tigno village. He said 2 suspects, identified as 30-year-old William Joshua and 23-year-old Ezekiel Luca, were arrested and are aiding police investigations. Authorities also recovered 29 rounds of live ammunition, 1 AK-47 magazine, and 90,000 naira in cash from the suspects, alongside other offensive weapons. Commissioner of Police Dankobo Murray appealed for calm, assuring that the command is taking all necessary legal measures to bring the perpetrators and the instigators to justice. The communal clashes, which erupted last month, have so far claimed over 18 lives, all reportedly women. The National Drug Law Enforcement Agency has intercepted various quantities of illicit substances, including ketamine, ecstasy, and tramadol pills, concealed in sachets of coffee mix and a book parcel, heading to Zambia and the United Kingdom. In a statement, NDLA Director of Media and Advocacy, Femi Babafemi, said the seizures made at a courier company in Lagos on December 24 and December 29 came just as the agency had taken into custody 22 India crew members of a merchant vessel. He said 31.5 kilograms of cocaine were seized by operatives at the GDNL terminal, Apapa Port, Lagos, on Friday. Babafemi said those detained in connection with the discovery of the cocaine in Hatch 3 of a ship which originated from the Marshall Islands included the master of the vessel and 21 other crew members. Meanwhile, NDLA operatives in Niger State on Monday arrested a wanted female drug kingpin, described as a major illicit drug distributor in Ibadan, the state capital. Babafemi said a 65-year-old grandmother, Fatima Ilori, popularly known as Mama Kerosene, was nabbed in an intelligence-led operation following the seizure of 238.4 kilograms of skunk, a strain of cannabis linked to her. In Borno State, the supply chain of illicit drugs to insurgents was further disrupted with the arrest of 2 suppliers and the seizure of large consignments of illicit substances. In another development, NDLA officers in Kwara State recovered 238.5 kilograms of skunk from the home of a suspect at the Asadam area of Ilorin. Still to come, 5 people killed in road crash in Langtang North local government area of Plateau State. We'll bring you more on this when we return.